Hi, I'm Dr. Takis. They call me Dr. T. And now I'm going to be showing you a brief understanding of what we do as chiropractors because it's very different than other healthcare professionals. Having done this for over 36 years and helped thousands of patients, it's very important to me that you understand the basics of how your body runs, because outside the doors of my office, the information that you get regarding your health is very, very different than what you'll get inside this office. Okay? So we're going to put a couple of truths here for you. Number one, your brain runs your body. Your brain runs your body. You don't. I guess this is probably looking at you backwards, right, with the camera, but that it does so via a two-way communication system. Okay? And that system is called your central nerve system. Stress affects your body. And there's three types of stress. You actually will get sick one day and die and leave your body due to one of these three types of stress. Either physical stress, chemical stress, or mental stress. Okay? Now, let's explain how this happens. So, what's physical stress? Physical stress would be using your body. In other words, you played high school sports, you wrestled, or you were a ballet dancer, or you were a cheerleader, or you like to play basketball, or you played tag football, or you were in a gym class one day and whack, you fell down on the gym floor, or you were 4 years old and you were climbing a tree and you got 6 feet up and boom, you fell on your back. Okay? Physical stress, automobile accidents, whiplash, okay? Whiplash, that's physical stress. Being pregnant, having your belly expand and contract and putting on 20, 30, 40, 50 pounds during the pregnancy. Those are all physical stressors. Not exercising on a regular basis, that is a physical stressor. Okay, good. Chemical stress. Chemical stress would be an improper diet. Okay. So let's say you eat a lot of processed foods. Instead of waking up in the morning and chop, 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 cook, cook, cook your food from real food, live food, vegetables, fruits, whole grains, doing the prep work. And yes, it's not easy being healthy. I never said it was going to be easy. Okay. So chemical stress would also be being on medications. Now, I totally get that, some of you might be on prescription medications and they're very important and you've had medical tests and examinations and this is what you need to be on at this point. However, my background's chemistry. I did not become a chiropractor because I couldn't get into med school. I became a chiropractor on purpose. As a matter of fact, I was sitting in a biochemistry class one day, true story, and the doctor said, for every one positive effect a drug has on the body, there are a minimum of three negative biochemical effects. And I raised my hand and I said, excuse me, Dr. Ritchie, do you mean that if a person takes an aspirin to get rid of his headache, like that might be helping his headache go away, but he's actually damaging at least three other areas of his body, maybe his heart, his kidney, his liver? And he said, absolutely. And wow, did I have a realization that day. It really changed my life. It completely changed my life. Okay, so there is no such thing as a safe drug. Now, sometimes something like insulin, where your body is so sick that you have to be on that drug to stay alive, then you need that drug. There's no other ifs, ands, or buts about it. But sometimes you can actually make lifestyle changes and work with your medical doctor to get off those medications. That's actually the ideal situation. Okay. I'm just saying, all drugs have negative biochemical side effects. And if you don't believe me, go to a website called drugs.com, type in your prescription, and start researching it. Find out for yourself. You should know what it is you're putting into your body. Okay. Take responsibility. It's the only body, it's your house. Okay. Until the day you die, it's the house you live in. Great. Okay. So that would be chemical stress. Chemical stress would also be, not drinking enough water. So many people walk around hydrated or dehydrated, I mean. Okay. Now, mental stress. Check this out. Mental stress. Oh my gosh. Two things you ain't got enough of. You ain't got enough time and you ain't got enough money. If I had $1 for every time I heard that, right? So, but that's the truth. Okay. Financial stress, relationship stress, being a parent stress, being an employee stress, being an employer stress, driving down Route 80 and you're in the left-hand lane and there is a guy or a gal in front of you doing the speed limit. My blood pressure goes up when that happens. That's stressful to me. Okay, I don't know for you, but for me, it's like, the left lane is a passing lane. Hello. Okay, so now of the three stresses, physical, chemical, and mental, okay, guess which one gives us 70% of our health problems? 70%, okay, studies show is due to mental stress. And for those of you with a sense of humor, the reason is we get it from men. It says so right there. Okay. Anyway, listen, nobody too serious is going to be healthy. I'm just saying. This is a very tough planet to live on sometimes. And if you can go through life with a little bit of a sense of humor, you're going to have a better life. I'm just saying. Okay. So mental stress, but that really is a lot of it. Okay. And I know so many things have changed in the past year or so. Listen, you have to confront your problems. You can't hide from your problems. You need solutions. Okay. You need people around you that support you and love you. And that is very important. And I will also say, I would hope that you're also spiritually connected. I don't care what religion you are. It could be anything. The point is that religion gives us a compass in life, and it is an important factor, in my humble opinion, for your overall well-being. Okay, with that said, now let's go back to how stress affects your body. Now, your brain runs your body. You don't. You are a human being. What does that mean? It means that you are a spiritual being that lives in a body that's run by a brain. One day, the body dies and the spiritual being leaves the body. That is what you are. That is the anatomy of you. Okay? Not enough doctors discuss this with people. It's true. This is how it is. Okay? Now, you can almost look at it like a puppet. If you had a puppet on top, right? And this over here, okay, you're the spiritual being, okay? And the strings would be like your brain and your nerve system running all the moving parts of your body, okay? And those little moving strings, okay, are what's running your body. And that's called your central nerve system. And it works electrically, okay? So now, that sets up a communication system in your body. Your brain tells your body what to do. The body part communicates back to the brain what to do. And you get to live your life, because I certainly know that when you eat a meal, after the meal, you don't tell your stomach, hey, stomach, I need some lipase created. It's an enzyme to break down the fat I just ate. No, you don't do that. Okay. That is your central nerve system perceiving that you have fat in your stomach, and now you have to start secreting enzymes to break down that fat. Okay. That's what we're talking about. It's a highly intelligent communication system. All right. That's your central nerve system. That is what is tapped into with chiropractic. See, chiropractic isn't just about, get an adjustment, your headache goes away. Get an adjustment, your low back pain goes away. No. The purpose of chiropractic is to allow your body to express health to your optimum potential. And everybody has a different optimum potential based on your age, your lifestyle, your genetic structure, everything happening. Okay. The idea is while we live, let us live. Not enough people say that either. Okay. So now your brain runs your body and stress affects your body. So stress affects your body. So now what's supposed to happen is stress comes in, your body adapts to it, and we call that function. Function equals health. Now, what does that mean? It means if I have a functioning, healthy body, okay, if I have a functioning, healthy body, I have a chemical stressor. So let's say that I ate some chicken that wasn't cooked enough, okay? And I take it in, and that chicken has salmonella on it. Salmonella, right? You know, you've heard of that, right? Okay. So my body goes, oh my God, it's got salmonella. And guess what happens? If I'm super healthy, I'm going to get rid of that chicken. I'm either going to throw it up or it's going to come out the other end, but that would be a sign of health. That is function. Function equals health. However, here's the problem. Here's the problem. You have been taught that feeling good means you're healthy. See, health equals feel good. That is the equation that you have been sold most of your life. Health equals feel good. In other words, I feel good, I'm healthy. Oh, really? Tell that to the 42-year-old who felt good and was driving home from work and had a heart attack, and he dies with 3 small children under the age of 10. Tell that to the widow. He felt good. He didn't have any symptoms. His first symptom was a heart attack, and it killed him. That is the sign of a very unhealthy body. Tell that to the woman who feels good and she's 55 years old and she eats organic and she exercises and she loves her husband and everything seems fine. And she goes for a routine mammography and finds out she has stage 3 breast cancer. She felt good. She felt good. Was she healthy? No. She was very sick. Very sick. Her immune system was not working. Okay. If your immune system's working, guess what, people? You can't get cancer. It's that simple. If your body is functioning, you don't get cancer. Okay. Okay. Now, the problem becomes, okay, when there's too much stress, then your body can resist. So stress comes in, your body can't react to it. And remember, these communication lines that run your body run electrically. So we're overloading that circuit. There's too much power going through there. And so it blows out the circuit right there. You get a blowout of the circuit, and we call that a subluxation. Okay, a subluxation. That's a pinched nerve. Now, the brain can't talk to the body can't talk to the brain. So instead of having function, we get malfunction. In other words, things don't work right. Over time, if things don't work right, because time, remember, is a friend of disease. So let's add time into the equation, okay? So if a body part is malfunctioning over time, we now get something called disease, which is a state of dis-ease. The body is not functioning right anymore. And guess what happens with diseases? Eventually, they give you something called symptoms, which probably is why you came to see us. Symptoms. So let's see how this plays out real time. And I'm going to give you a real story of a real patient that came here. Okay. So I had a case history, and I was talking to this guy. He was in his late 20s, and I looked at his history, and I saw that when he was, I don't know, 9, 10 years old, he was in the playground, and he was on those monkey bars, right? They go with the monkey bars, and he fell off the monkey bars onto his back, and he lost his ability to breathe, and he was really freaking out. And his mother immediately thought he broke some ribs and took him over to Newton Hospital. They did x-rays, they checked him. They said, Mrs. Jones, I'm obviously not using real names here. They said, Mrs. Jones, don't worry, Danny is fine. He just got the wind knocked out of him. Well, guess what? Danny was not fine. When he landed on his mid-back, okay, he created a physical subluxation between his brain and his stomach. Okay, between the brain and his stomach. The nerves in your mid-back supply the stomach. He had no symptoms. Now let's talk about what happened to Danny between the age of 9 and 28 years old. So that's like basically 20 years later, right? 20 years go by. What happened to Danny in that time? Well, he played football. He got in some car accidents. He fell in love. He then drank way too much because he was drowning his sorrows. He was 19 years old. He told me the story about that. Okay. And then he was commuting to work 1 hour each way a day. That's 2 hours a day, 5 days a week. That's 10 hours a week, which is one full work day. Okay. In the car, which, trust me, is not good mechanically for your spine. Not to mention the aggravation on the highways with all the crazy people. Okay. So now he wakes up one morning and he's got, guess what? Let's see what happened. So let's just say that before this injury, when he was 9 years old, every time he ate food, his body used to produce 5 milliliters of hydrochloric acid, okay, in his stomach. After that injury, when he was 9 years old, his body starts to produce 8. Malfunction. So he used to produce 5 milliliters of acid. Now he starts producing 8. He's 9 years old. There is no symptom. He's a little kid. Okay. However, over the course of those 20 years, life happened to him. Okay. Eventually, okay, it turned into a disease process called what? An ulcer. And what is the symptom of an ulcer? Pain after eating. Okay. So now what he had done is he had gone to his doctor. He was having stomach pain, and the doctor put him on a medication to handle that drug. So guess what they actually did? They knocked out the symptom with the drug. Okay, so they turned off the fire alarm. They let the fire burn. They never found out the cause of the fire, did they? No, they just shut off the alarm, the symptom, the pain after he ate, and they just let him on his life, and he was on this medication for a couple of years, and he was only 28 years old. So it was so funny because on the first page of the our history form, I have the question, did you ever experience any falls? And he told me this story. I didn't even know why he was coming to me yet. I didn't know that what medications he was on. I had no idea. And I looked at him and I said, when I heard about this fall, I said, have you had stomach problems? And I kid you not, Danny got white as a ghost. And he said, Dr. T, how would you know that? I said, well, the nerves in your mid-back supply your stomach and your upper gastrointestinal tract. And if the power that was going to those nerves was on dim as opposed to being on bright, then that might be an issue for your gastrointestinal tract over a course of 20 years. I go, did you ever get an ulcer? And he was like, oh my God, I can't believe you even thought this. Now, I forgot to mention here, when you get these subluxations, studies have shown there is a minimum of a 40% loss of the power, the electrical power, the messaging power that goes between your brain and your body part per level of subluxation. So basically, you're on dim as opposed to on bright. And I don't know about you, but I think that this planet and the people and the situations in it are stressful enough that I would prefer to go through my life with my power turned on than my power turned down or off. And I know this isn't the message that you are going to hear anywhere else. It's not, it's not going to ring any bells, or it's just simple. Okay. Power on, your body functions better. Power on dim, your body doesn't function as well. And how can I say this? I've treated thousands of patients. I've watched them get well. And here's the sad part of this story, and this is the truth. I can tell this particular chart to 20 people. And I have done this and I have run the numbers. Out of 20 people, maybe six will actually understand and maintain the health of their nervous system throughout their lifetime. Why is that? What I just said makes sense, right? It's logical. The problem is when you leave my doors, you are being bombarded with messages. No symptom equals no problem. I feel good. I am healthy. I wish that that were the case, that it was that simple. But, a lesson in life is nothing worth anything in this life comes easy. I hate to break it to you. If you're looking for an easy out in this life, it ain't going to come. Anything worth anything, you have to earn. And I mean that sincerely. Whether it's your health or your family or your marriage or your career, it doesn't just land in your lap and then you don't have to work to maintain it or keep it functioning. If you want a healthy body, you got to eat well. You got to exercise. You got to confront your problems in life. And if you do those things and keep the power on that's running your body for you on your behalf, you're going to have a heck of a lot of a better time on your journey this lifetime. Okay. That's what I wish for you. I wish that you can experience life and not become old. And my prayer for you is that you die at 75 or 85 or 95 doing what it is you love to do. Many of you know I'm a skier and I ride horses. I still do those things. Okay. And despite having issues, I handle those issues. We do a variety of different things in this office to make sure that our bodies are functioning. But to get old and not experience a quality of life, that is not my prayer for you. Okay. So I hope this was helpful. And if you have any questions, just ask me. I'll answer them. And I hope that you can understand that becoming well again is a process. And I look at myself like your coach in that area. I'm here for you. And if I don't know the answer, I'll find the answer or I'll send you to the person who can give you that answer. Okay. So thank you very much for coming in. And by the way, I am going to quiz you. I am going to ask you what a subluxation is. Okay. It's a bone out of place, stuck out of place, causing nerve pressure. Again, it's a bone in your spine out of place, stuck there, causing nerve pressure. Okay. So welcome to your journey toward better health. Bye-bye.